everyone. Today I'm going to discuss antibacterial resistance with a focus on MRSA. Antibacterial resistance is a significant public health issue that impacts the effectiveness of treatments for bacterial infections. It's essential to understand how resistance develops and what we can do to fight it. Now let's start with the image at the top right, labeled MRSA, which stands for methicillin-resistant Staphylococcus aureus. MRSA is a type of bacteria that has developed resistance to many antibiotics, including methicillin and other penicillin-related antibiotics. This resistance makes MRSA infections challenging to treat. The image shows a skin infection caused by MRSA, which typically appears as red, swollen, and painful sores. These infections can develop into deeper abscesses, which may require surgical drainage in addition to antibiotic therapy. MRSA can spread through direct contact with an infected wound or by sharing personal items that have touched infected skin. It's prevalent in hospitals and healthcare settings, but can also be found in the community. Hospital-acquired MRSA is often more resistant to antibiotic than community-acquired strains. Now, let's look at the cartoon in the center. This image illustrates the mechanism of how bacteria develops resistance. One primary method is horizontal gene transfer, where bacteria can acquire resistant genes from their environment. This can happen through the uptake of free DNA, plasmids, or transposons from the bacteria. These resistance genes often encode proteins that neutralize the effects of antibiotics. For instance, some bacteria produce enzymes like beta-lactamase that break down beta-lactam antibiotics, such as penicillin. Other mechanisms include altering the antibiotic target site, reducing antibiotic uptake, or increasing efflux pumps to remove the antibiotic from the bacterial cell. This adaptability makes bacteria formidable opponents in the fight against infections. Moving to the bottom part of the slide, we have the chemical structures of penicillin and penicilloic acid. Penicillin can represented on the left, is a beta-lactam antibiotic that works by inhibiting the synthesis of bacterial cell walls. It binds to and inactivates penicillin-binding proteins involved in the cross-linking of the bacterial cell wall peptidoglycan. This results in a weakened cell wall and eventually leads to bacterial cell lysis and death. However, some bacteria produce the enzyme beta-lactamase, which hydrolyzes the beta-lactam ring of the penicillin, rendering it ineffective. The resulting product, penicilloic acid, shown on the right, cannot inhibit the cell wall synthesis. This enzymatic breakdown of penicillin is a primary resistant mechanism among the beta-lactamase producing bacteria. On the left side of the slide, there's an image of a hand reaching for a bowl of pills, accompanied by the message, "Misuse of antibiotics puts us all at risk." This highlights the critical point. The misuse and overuse of antibiotics are major factors contributing to the development of resistant bacteria. Misuse includes taking antibiotics when they are not needed, such as for viral infections like the common or cold flu. Not completing the full course of prescribed antibiotics and using antibiotics without medical supervision, additional to the use of antibiotics in agriculture to promote growth in healthy animals, contributes to the development of resistant bacteria, which can be transmitted to humans through the food supply. Antibiotic stewardship programs aim to promote the appropriate use of antibiotics in healthcare settings. These programs include guidelines for prescribing antibiotics, monitoring antibiotic resistant patterns, and educating healthcare providers and patients about the responsible use of antibiotics. Thank you.